Over the last 40 years, the burden of gout, a painful inflammatory arthritis, has risen considerably, now affecting millions of Americans. Gout is now the most common inflammatory arthritis in men and older women. In my video, Gout Treatment with a Cherry on Top, I profiled new research suggesting that even as little as a half a cup of cherries a day may significantly lower the risk of gout attacks. Fresh cherries aren't always in season, though, so I listed a few alternatives, and frozen appeared second best, with cherry juice concentrate the runner-up. But does concentrated cherry juice actually help prevent attacks of gout? We didn't know until now. The first pilot study was a randomized controlled trial, cherry juice concentrate versus pomegranate juice concentrate as a control, for the prevention of attacks in gout sufferers who were having as many as 4 attacks a month. The cherry group got a tablespoon of cherry juice concentrate twice a day for 4 months, and the control group got a tablespoon of pomegranate juice concentrate twice a day for 4 months. The number of gout flares in the cherry group dropped from an average of 5 down to 2, better than the pomegranate group, which only dropped from about 5 to 4. And about half of those in the cherry group who were on prescription anti-inflammatory drugs were able to stop their medications within 2 months after starting the cherry juice, as opposed to none of the patients in the pomegranate juice group. The second study was a retrospective investigation over the longer term. 24 gout patients went from having about 7 attacks a year down to 2. The researchers conclude cherry juice concentrate is efficacious for the prevention of gout flares. Certainly large, long-term randomized controlled trials are needed to further evaluate the usefulness of cherries and cherry juice concentrate for gout flare prophylaxis, but in the meanwhile, are cherries now ripe for use as a complementary therapeutic in gout? This commentator is of the opinion that the current state of evidence remains insufficient to formally recommend cherry fruit or cherry products as a complementary therapeutic remedy for gout. Why not? Can you guess who this guy is? This commentator is also a paid consultant of 9 different drug companies, all of which manufacture gout medications. I understand how the pharmaceutical industry can get nervous seeing studies where half of patients were able to stop taking their gout drugs, given the billions of dollars at stake. But what's the downside of eating a half a cup of cherries a day, or worse comes to worse, a few spoonfuls of cherry juice?
Today, in our another Alki Pharma impromptu commercial, we are going to look at Gout Plex, or Goutplex, if I can get it in the right light so you can read it. Well, forget that. All right, what we're looking for is Goutplex. The reason Alki Pharma produces this product is simple, because it has 2 of the best main ingredients that you could possibly use for gout in a product combined. Now, we don't like formulas with a lot of different weird stuff in it, but we like to see things with therapeutic levels of just a few main ingredients. Not pretty labels, but effective labels and effective products. The reason it's effective is because the 2 main ingredients in this product is black cherry extract and celery seed extract. And what that means to you is very simple. Black cherry, for example, was recently shown in a study not too long ago. In fact, that study was basically done in September 28th, 2012. It was done at the American College of Rheumatology. They found out that black cherry, in 2 days, lowered uric acid levels down by 35%. And when used in combination with the gout medications, reduced the likelihood of flare-ups of gout by 75%. That's not too shabby for black cherry alone. And that's just one study. And that's a recent study. Now, let's turn the tide because we want to make it a fast commercial. Let's look at celery seed. All right, the Alki Pharma includes the celery seed for this primary reason. Actually, 2 reasons. If we look at celery seed, let's say one of our studies from University of Queensland, Brisbane, pilot medical study for pain relief and rheumatic pain, School of Medicine, University of Queensland, without being repetitive. It lowered pain scores in 6 weeks by 68% on average in the study group. Moreover, a good portion of the study group, after 6 weeks, including gout, rheumatoid arthritis, etc., 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 anything usually inflames the joints, had 100%. That means no pain after 6 weeks, just by taking celery seed extract. Basic, simple, no side effects you really don't have to worry about unless you have kidney conditions. All right, and that's one study. Then, if you look at the uric acid lowering effects of the celery seed, we find something even more amazing. All right, remember in combination with the black cherry, 35% reduction in 2 days. All right, now if we look at, let's see, this study was done in the Phytomedicine Journal, suppressing COX-2. And the date was evaluation of anti-gout activity of some plant extracts, 2008, Food and Nutrition Science, 58.339-95. That's just the study, put the footnote, so big footnote fanatic. But what they found out, it reduced uric acid levels down by another 56%. Now you understand why we like to focus on just 2 primary ingredients, celery seed and black cherry, in regards to lowering the uric acid levels dramatically and fast. Second reason is the pain relief that celery seed gives naturally, outside of a slew of tons of other benefits, from breast cancer to blood pressure to anxiety, you name it, the whole lineup. Again, Alki Pharma Go Out Complex, designed with intent, designed for a reason. And if you had to grab one thing for gout, this should be one of the first things you look at grabbing. Thank you very much. This is Ralph Turchiano, Vitamin Herb Stores, just showing you the Alki Pharma Gout Complex.